Chris, thank you so much for joining me today. Can you tell me a little bit about yourself and your role at Community Living Huntsville?
So my name's Christopher Jordan Stevens. I started working at Community Living about 5 years ago. I started frontline. I was working with our CP and SIL program. I was then the supervisor of our supported independent living program, and now I'm the manager of our supported group living programs.
Chris, at Community Living Huntsville, our staff walk us alongside people with developmental disabilities, and I'm wondering what you have heard from staff about how difficult the struggle has been with regard to food insecurity.
So since I've started, I've heard probably 3 themes, I would say, from staff about sort of where people we support are at in terms of food security. The first one is, of course, related to cost. That the price, given their economic circumstances, the prices of food are really, really high. And so they often have to supplement their food supply in other ways. So in terms of cost, in terms of choice is another one. They feel that because of the economics of food, their choices are really, really limited in what they can, the kind of nutrients they can find. And then the third one is that there's a certain mental health part of food security, which is that a lot of people we support, it takes up a lot of their thinking in planning. It's a big part of their day. Well, how am I going to find the food that I'll need over the next week, right? So there's sort of those 3 dimensions that I'm hearing from staff.
So if I just went back to the second dimension about choosing food, what type of choices are people forced to make?
So when you are on a limited budget, the choices you make in all aspects are limited. So with food, it's high sugar foods, a lot of carbohydrates, a lot of processed foods. Greens are very expensive with now, I'm sorry, I'll just say one kind of economic thing with supply chain issues in the last couple of years. Like there's been an increase in a lot of the best kinds of foods, like foods we import, veggies, those kinds of things, and meats is another one. So when people have a limited budget, it's interesting because the food they end up purchasing has the nutritional benefits are very short term. Right? And that has a real impact on every aspect of their life. I mean, there's long-term health impact for diets for people who are in the low income. We know that. The other part is just in terms of energy.
Right.
Somebody whose food is kind of making their energy do this. Right. It makes things like getting out in the community and doing recreational activities or being gainfully and meaningfully employed that much more difficult for people we support who face enough barriers in those areas as it is.
What do you feel is the main reason people can't afford food? I'm sure there's lots of reasons, but what do you think is the main contributing factor?
I might not be able to answer that. But I can answer that I was reading in preparation for this, I was reading something that said that around 60 or over 60% of people who receive some kind of social assistance are food insecure. And so
it's a high number.
It's a very high number. And that's because for the people we support who their social assistance is through ODSP, those funds have been now stagnant and insufficient for years, and it keeps people well below the poverty level. So I would say the cause is poverty. However, if you ask me what the cause of poverty is, then that's why it took me a moment to think. But I would say the number one cause is poverty. And not only that, we've seen, it's been in the news, it's not that food prices have stayed the same. There's been a great deal of inflation with food.
Right.
And it's also important to know, though, and I want to make sure that we understand that this doesn't just affect people on social assistance who are on ODSP, that roughly 50% of the people in Canada who are food insecure are people who aren't on social assistance, and that their main source of income is through employment.
Right.
Yeah.
So it's a huge issue.
It's a gigantic issue, and people with developmental disabilities are not alone in that.
Right.
But like is often the case, they feel the impacts with greater force.
Right. Right. Chris, What impacts do you think food insecurity and hunger are having on people?
Well, if you think about it, think about what you do in community, or what you want to do in community. You want to get out, you want to, go to a restaurant or go to a show. You want to be able to see your friends. You want to have employment, and if you're unhappy with your employment, you want the opportunity to look elsewhere and to develop. You want to engage with educational opportunities, and all of that is compromised when a lot of your mental space and energy is taken up fighting for basic human rights and necessities.
Right.
And it's just a time thing in some ways. But if you think about it, the other area where people are struggling so hard right now is with housing. So we're talking about food and housing. And if people's minds are taken up and all of their funds are being used in that way, there's no remainder for the costs of inclusion. Right? If we always talk about the importance of inclusion, of course it's important for people that we support to be included in their community, but part of that is for them to have the funds to do so and the energy and the time to do so. And those things are compromised by food and housing insecurity.
Right.
Yeah.
And we've talked a lot about all of these problems and these issues. What are some of the solutions?
So, like any long-term solution, it's going to require a combination of grassroots intervention, but also system change at the level of government. We're talking system-wide changes in how primary goods are distributed. And what I mean by primary goods is I mean food and housing, and how they're fairly distributed to people who wear labels like developmental disability or mental illness or what have you. And those changes would have to include some kind of more universal basic income provision, some kind of entitlement program that would just bring people to the level where they could make choices around what they eat. They might not have to supplement their food and their diet with less healthy options, and they might be able to break certain food cycles that they've been caught in, many of them since children. We have to remember that many of the people we support, not all of them, but many have been food insecure probably for most of their lives. And so a real important part of the solution is not allowing those cycles to form early. It also means that we should continue to hold food suppliers accountable and understand that they play a really important role in distributing what is an essential public good, I think, is food. So the solutions have to be system-wide, and they have to really look at bringing people, lifting all boats and bringing people to the same level, so that the opportunity is equal for people in their communities.
So I would assume that a lot of that too is lobbying our government.
Absolutely, and I mean a major thing is lobbying them to, of course, ensure that food suppliers are not, price gouging citizens and all of that stuff. But the other part of it is making sure people who need social assistance aren't living in poverty in virtue of needing it.
Right.
Because food and access to food is a human right, just like access to safe and attainable housing is. And so we have an obligation to find a solution to this. We have a moral and in some capacity a legal obligation to find a solution to this.
So the first step for our viewers could simply be sending a letter to their officials.
Absolutely.
Excellent.
Absolutely. Yeah,
Excellent.
I would, sending a letter, but be specific about what the issue, which in this case is food insecurity, and that people are unable to make healthy food choices based on the incomes that are being provided to them, and that their income is limited largely because they wear the label of a developmental disability, and there are exclusionary forces, for employment, for education. We know that. That's why Community Living Huntsville is here.
Right.
But we need to then compensate better for people so that they can live healthier, longer, and more meaningfully included lives in their community.
Excellent. Thank you so much for joining me today.
Anytime.